These 5 foods quietly damage your kidneys after 60. Opening hook. What if I told you that one of the biggest threats to your kidney health may not come from something you take once in a while, but from foods you eat regularly without giving them a second thought? You may be eating them for breakfast, you may be adding them to your lunch, you may even have them sitting in your kitchen right now. And here's the surprising part. Some of these foods don't make you feel sick right away. They don't cause obvious pain. You eat them, you go about your day, and everything seems normal. But your kidneys are working quietly in the background, filtering your blood, balancing fluids, managing minerals, and helping your body get rid of waste. As we get older, especially after 60, protecting these hardworking organs becomes more important. Today we're going to talk about 5 common foods that may put extra stress on your kidneys when eaten too often or in large amounts, especially if you already have high blood pressure, diabetes, or reduced kidney function. And stay with me until the end because I'll also share some simple foods you can choose instead, plus a few everyday habits that can help support your kidneys as you age. This isn't about being afraid of food, it's about becoming more aware of what your body needs. Because when it comes to kidney health, small changes made consistently can make a meaningful difference. Let's begin. Introduction. Why kidney health matters. More after 60. Your kidneys are remarkable organs. Most people think of them as simply the body's filters, but they do much more than that. Your kidneys help remove waste from your blood. They help control the amount of water in your body. They play an important role in maintaining healthy levels of minerals such as sodium, potassium, and phosphorus. They also help regulate blood pressure and support the production of red blood cells. The problem is that kidney problems can develop quietly. You might not feel anything unusual in the early stages. That's why regular checkups and healthy habits are so important as you get older. Kidney health is closely connected to other health conditions that become more common with age. High blood pressure can damage the tiny blood vessels inside the kidneys. Diabetes can also harm the kidney's filtering system over time. And certain medications, dehydration, and other medical conditions can add additional stress. This is why your diet matters. But I want to make something very clear before we continue. There is no single food that automatically destroys your kidneys. The real issue is often frequency, portion size, preparation, and your individual health condition. A food that is perfectly reasonable for one healthy person may need to be limited by someone with chronic kidney disease. So today, think of this video as a guide for awareness, not a reason to panic. If you have been diagnosed with kidney disease, always follow the advice of your doctor or registered dietitian. Now let's look at the first food. Food number 1, processed meats. Let's start with one of the most common foods in many households, processed meats. This includes foods such as bacon, sausage, hot dogs, deli meats, ham, and certain packaged meat products. Now you may be thinking, I've eaten these foods for years, what's the problem? The concern isn't necessarily one slice of bacon or one sausage at a special breakfast. The bigger issue is eating these foods frequently. Many processed meats contain significant amounts of sodium, and sodium matters because your kidneys play an important role in maintaining fluid balance. When you consume too much sodium, your body may hold on to more water. For some people, this can contribute to higher blood pressure, and high blood pressure is one of the major risk factors for kidney disease. There's another issue. Processed meats are often highly processed and may contain preservatives and other additives. If your kidneys are already working less efficiently, your doctor may recommend limiting certain nutrients or additives depending on your individual condition. So what can you do? You don't necessarily have to completely eliminate every processed meat from your life unless your healthcare professional has told you to. Instead, think about frequency. If bacon is part of your breakfast every morning, consider reducing it. If you eat deli meat sandwiches several times a week, try replacing some of those meals with fresh chicken, fish, eggs, or a plant-based protein that fits your health needs. And here's a simple habit. When you buy packaged foods, turn the package around. Look at the sodium content. You may be surprised by how quickly sodium adds up throughout the day. Remember, your kidneys don't care whether the sodium came from a fancy restaurant or a packaged sandwich. They still have to deal with it. So the first step is awareness. Food number 2, salty packaged foods. Now let's talk about another major source of hidden sodium, packaged and highly processed foods. Think about canned soups, instant noodles, frozen dinners, salty crackers, chips, packaged sauces, ready-made meals. Some of these foods may seem harmless because they come in small portions, but the sodium can add up quickly. Imagine starting your morning with a processed breakfast, then having a sandwich with deli meat for lunch, then eating canned soup for dinner. Each individual food may seem manageable, but together, they could provide a very large amount of sodium. For someone with high blood pressure or kidney disease, that may be a concern. One of the most useful things you can do is learn to read nutrition labels. Look for the sodium amount per serving. And be careful, sometimes the package contains 2 or 3 servings, but you may eat the entire package without realizing it. This is especially common with soups, crackers, and frozen meals. Now here's the good news. You don't need to make every meal complicated. You can prepare simple foods at home using fresh ingredients. Try vegetables. Fresh or frozen options can both be useful. Choose plain rice or whole grains when appropriate. Use herbs, garlic, lemon, or spices to add flavor instead of relying heavily on salt. And if you buy canned vegetables or beans, look for lower sodium options when available. You can also rinse certain canned foods to reduce some of the sodium. The goal isn't perfection. The goal is to gradually reduce the amount of sodium your body has to process. And if you're someone who has been told to follow a low-sodium diet, take that recommendation seriously. It can be an important part of protecting both your heart and your kidneys. Food number 3, sugary drinks and too much added sugar. Now let's talk about something that doesn't always look like a kidney problem: sugar. Especially sugary drinks. Soda, sweetened tea, energy drinks, fruit-flavored beverages, and other drinks with large amounts of added sugar. Why does this matter? Because your kidney health is closely connected to your overall metabolic health. Consistently consuming too much added sugar can contribute to weight gain and may make it harder to manage blood sugar. Over time, uncontrolled diabetes can damage the small blood vessels that help your kidneys filter your blood. This is one reason managing blood sugar is so important for people with diabetes. And here's something many people overlook: drinking calories can be much easier than eating them. You might not feel full after drinking a sugary beverage, so you could consume a large amount of sugar without realizing it. Instead of reaching for a sweetened drink, consider water as your first choice. If plain water feels boring, add a slice of lemon or lime. You can also drink unsweetened tea if it fits your preferences and health needs. The key is to look at your daily habits. If you have one soda once a month, that's very different from drinking several sugary beverages every day. Again, it's about patterns, and remember, if you have diabetes or pre-diabetes, speak with your healthcare professional about the best approach for your individual diet. Your kidneys and your blood sugar are more connected than many people realize. Food number 4, certain high-phosphorus processed foods. Now we're moving into a topic that is especially important for people who already have reduced kidney function: phosphorus. Phosphorus is an essential mineral. Your body needs it for healthy bones and many normal functions. But healthy kidneys help regulate phosphorus levels in your blood. When kidney function declines, phosphorus can sometimes build up. This is why people with chronic kidney disease may be advised to monitor their phosphorus intake. The important point is that phosphorus is not automatically bad. Your body needs it. The concern is more about getting too much, especially when kidney function is reduced. Some processed foods contain phosphorus-based additives. These may be found in certain processed meats, packaged foods, processed cheese products, instant foods, and some beverages. One useful habit is to check ingredient lists. Look for ingredients containing the word PFAS. For example, you may see terms such as phosphate or phosphoric acid. This doesn't mean you should automatically avoid every food containing these ingredients, but if you have kidney disease, it may be worth discussing them with your healthcare professional. This is an area where personalized advice is particularly important. For a person with normal kidney function, the dietary approach may be very different from someone with advanced kidney disease. So don't make major restrictions based on a YouTube video alone. Instead, use this information as a reason to ask better questions at your next medical appointment. You can say, should I be monitoring phosphorus in my diet? Are there foods I should limit based on my kidney function? Would a renal dietitian be helpful for me? Those questions could be much more valuable than simply eliminating foods at random. Food number 5. Large amounts of certain high potassium foods if your kidneys are not working well. Now, this is where we need to be especially careful. You've probably heard that potassium is healthy. And that's true. Potassium is an important mineral that helps your muscles, nerves, and heart function properly. Many healthy foods contain potassium: bananas, oranges, potatoes, tomatoes, beans, leafy greens, avocados. So why am I mentioning potassium in a video about foods that may be a concern for kidney health? Because if your kidneys are not functioning properly, your body may have difficulty removing excess potassium from your blood. And in certain people with chronic kidney disease, potassium levels can become dangerously high. This does not mean everyone over 60 should stop eating bananas or vegetables. Absolutely not. If your kidneys are healthy, you generally should not fear potassium-rich foods simply because you're getting older. The concern is for people with kidney disease or certain medical conditions. This is why personalized advice matters. Your doctor may check your kidney function and potassium level through blood tests. If your potassium is normal and your kidneys are functioning well, your dietary recommendations may be completely different from someone with advanced kidney disease. So please don't take this section as a reason to remove healthy fruits and vegetables from your diet. Instead, take it as a reminder to know your numbers. If you've been diagnosed with kidney disease, ask your doctor, is my potassium level normal? Do I need to limit potassium-rich foods? Which fruits and vegetables are best for me? These questions can help you create a diet that's right for your body. The hidden problem. It's often not just one food. Now let's take a step back. You may have noticed something important. The 5 food categories we've discussed are not all harmful to everyone. In fact, some foods on this list can be part of a healthy diet for many people. The real question is, what is your kidney function and what does your body need? For example, a healthy person may enjoy a banana. Someone with advanced kidney disease may need to monitor potassium. A person with normal kidney function may eat a variety of foods containing phosphorus. Someone with chronic kidney disease may need a more carefully controlled diet. This is why I don't want you to leave this video feeling afraid of food. I want you to leave feeling informed. Your kidneys don't need a perfect diet, they need consistent support. And that brings us to some practical habits you can start using. Tip number 1, know your kidney numbers. One of the simplest things you can do is ask your doctor about your kidney health. Blood tests can help assess kidney function. Your doctor may look at measures such as creatinine and estimated glomerular filtration rate, often called eGFR. Urine tests can also provide important information. If you're over 60, especially if you have diabetes, high blood pressure, heart disease, or a family history of kidney problems, ask your healthcare professional whether regular kidney testing is appropriate for you. Don't wait until you feel something is wrong. Kidney disease can develop without obvious symptoms in its early stages. Knowledge gives you options. The earlier you know about a problem, the earlier you and your healthcare team can discuss what to do. Tip number 2, keep blood pressure under control. Your kidneys and your blood pressure have a very close relationship. High blood pressure can damage the blood vessels in your kidneys, and damaged kidneys can make blood pressure harder to control. It can become a cycle. That's why checking your blood pressure regularly is so important. If your doctor has prescribed medication, take it exactly as directed. Don't stop or change your medication because you watched a video online. And don't assume that feeling fine means your blood pressure is normal. High blood pressure often has no obvious symptoms. A simple blood pressure check can tell you much more than how you feel. Tip number 3, stay hydrated but follow your doctor's advice. Your kidneys need water to function properly. For many healthy adults, drinking enough fluids throughout the day is an important part of overall health. But there is an important exception. If you have advanced kidney disease, heart failure, or another condition that requires fluid restriction, you may need different advice, so don't force yourself to drink excessive amounts of water just because someone online says you should. Your fluid needs are personal. Ask your healthcare professional how much is right for you. For most people, the goal is simply to avoid becoming regularly dehydrated and to drink according to thirst and medical guidance. Tip number 4, be careful with pain medications. This is one that many people overlook. Certain pain medications, particularly non-steroidal anti-inflammatory drugs, commonly called NSAIDs, can affect kidney function in some people. Examples include medications such as ibuprofen and naproxen. These medicines can be useful for certain conditions, but they aren't appropriate for everyone. If you're older, have kidney disease, have high blood pressure, or take multiple medications, talk with your doctor or pharmacist before using these medications regularly. And remember, over-the-counter does not automatically mean risk-free. Your kidneys don't know whether a medication came from a prescription bottle or a store shelf. Always consider your complete health picture. Tip number 5. Don't believe every kidney detox. Now let's talk about something I see frequently online: kidney detox drinks, special cleansing teas, herbal mixtures, expensive supplements. The promise is usually simple: take this and your kidneys will be cleansed. But your kidneys already have a natural filtering system. You don't need to buy a magical detox drink to make them work. Some supplements can even interact with medications or cause problems in certain people. If you have kidney disease, you should be especially careful about taking supplements without medical guidance. Natural doesn't always mean safe. Before starting a new supplement, ask your doctor or pharmacist. It could save you from an unnecessary complication. What should you eat instead? Now let's make this practical. If you're trying to support your kidney health, Focus on an overall eating pattern rather than searching for one miracle food. Depending on your individual health, this might include more minimally processed foods, fresh or frozen vegetables, fruits in appropriate portions, whole grains when suitable, lean sources of protein, fish, eggs, beans or other plant proteins when appropriate for your kidney health, healthy fats, and fewer highly processed foods. But again, kidney disease changes the conversation. Some people with chronic kidney disease may need to limit sodium, some may need to monitor potassium, some may need to control phosphorus, some may need to adjust protein intake. There is no universal kidney diet. That's why individualized medical advice is so valuable. A simple day of kidney-friendly habits. Let's imagine a simple day. You wake up in the morning. Instead of immediately reaching for a highly processed breakfast, you choose a balanced meal that fits your health needs. You take your prescribed medications as directed. You drink an appropriate amount of fluid. You check your blood pressure if your doctor has recommended home monitoring. During lunch, you choose a meal with less processed meat and less added sodium. In the afternoon, instead of a sugary drink, you choose water or an unsweetened beverage. You take a gentle walk if you're physically able. At dinner, you focus on simple foods rather than heavily processed packaged meals. Before bed, you avoid taking unnecessary medications or supplements without medical guidance. None of these actions is dramatic. That's the point. Healthy aging is often built through small decisions repeated over and over. The most important message for anyone over 60. If there's one thing I want you to remember from today's video, it's this. Your kidneys deserve attention even when you feel perfectly healthy. Don't wait for symptoms. Know your blood pressure, know whether you have diabetes, ask about your kidney function, review your medications, and pay attention to the foods you eat regularly. You don't need to become obsessed with every bite of food. You simply need to become more aware. And if you already have kidney disease, don't try to manage it alone. Work with your healthcare team. A doctor or registered dietitian who understands kidney disease can help you create a plan that fits your specific needs, because your diet should be based on your body, not someone else's. Red flags you should never ignore. Now, before we finish, let's talk about symptoms. If you notice significant swelling in your legs, ankles, or feet, persistent changes in urination, blood in your urine, severe fatigue, unexplained nausea, shortness of breath, or other concerning symptoms, talk with a healthcare professional. These symptoms can have many possible causes, and they don't automatically mean you have kidney disease. But they deserve attention, and if you have severe symptoms or feel seriously unwell, seek urgent medical care. Remember, your body often gives you signals. You don't have to panic, but you should listen. Conclusion. So let's quickly review the 5 food categories we discussed today. Number 1, processed meats, which can be high in sodium and may be best limited, especially when eaten frequently. Number 2, salty packaged foods, which can quietly add large amounts of sodium to your daily diet. Number 3, sugary drinks and foods high in added sugar, which can contribute to problems such as weight gain and poor blood sugar control. Number 4, certain processed foods containing phosphorus additives, which may be particularly important to consider if you have reduced kidney function. And number 5, large amounts of high potassium foods, which are healthy for many people but may need to be limited in some individuals with kidney disease. But remember, this isn't a list of foods that everyone over 60 must avoid. Your kidney health is personal. Your blood tests matter, your medications matter, your blood pressure matters, and your overall diet matters more than any single food. So don't leave this video thinking, I can never eat these foods again. Instead, ask yourself, how often am I eating them? How much am I eating? Do I have a health condition that changes what I should eat? And most importantly, have I talked with my healthcare professional about my kidney health? Those questions can help you make smarter decisions. Your kidneys have been working for you every day of your life. Now is a good time to start working a little harder for them. If you found this video helpful, please like the video. It helps more people discover this information. And if you're interested in simple, practical health information for healthy aging, subscribe to the channel and turn on notifications so you don't miss our next video. I'd also love to hear from you. Tell me in the comments, have you ever had your kidney function checked? And if you already know your kidney numbers, let us know what health habit has helped you the most. Remember, getting older doesn't mean giving up on your health. Every healthy choice you make today is an investment in the years ahead. Take care of yourself, take care of your heart, take care of your kidneys, and I'll see you in the next video. Medical disclaimer: this video is for general educational and informational purposes only and is not intended to provide individual medical advice, diagnosis, or treatment. Dietary needs vary significantly between people, especially for those with chronic kidney disease, diabetes, high blood pressure, heart disease, or other medical conditions. Always speak with your doctor or qualified healthcare professional before making significant changes to your diet, medications, or supplements. Never stop or change prescribed medication based solely on information from this video.